So it's my time, right? Thank you, Konkit, and the committee who are to giving me opportunity to come here to give a brief review of the condition, which nowadays seems to be a little debate on the terminology, whether we should consider the REDS or relative energy deficiency in sport or female athlete triad, which one should be the more appropriate term to use. And I think this topic might interest the big group of ladies over there. If you don't mind, please come forward to the front. And I think my talk is going to be in bilingual, which means that if you are not comfortable to ask questions in English at the end of the session, you can ask in Thai. I guarantee that I can understand Thai very clearly, right? But because of the format of the meeting here, I have been forced to speak English, so I will start my talk right now, right? So I'm going to talk about the two terms or names of the condition, which I would like to review. That in the past, back up to 1997, there was a term called FAT, or Female Athlete Triad, which was initially introduced by the American College of Sport Medicine. And then later on, in 2014, the IOC, International Olympic Committee, has introduced the new term that they believe to be much more broader and more concise, which is called the relative energy deficiency in sport. So I'm trying to clarify today that is it a battle between these two groups of experts, and any way to compromise in terms of the concept and the knowledge. Right. So I will start with the REDS, which introduced by Margot Mountjoy of the IOC. This paper is from 2014, right? Which was the IOC consensus statement that the REDS is something much better, and it is beyond the concept of female athlete triad. If you look at the heading terms, the head of the article, you will see that it is a kind of insulting paper. So a bit harsh to the FAT fans, right? Overall, the concept of the REDS is that it claims to be the wide and complete concept, trying to explain the health consequence of the condition when athletes suffer from energy insufficiency, and say that the FAT is just a small fraction, a small part of the REDS, because the FAT focus on the effects of energy deficiency in terms of the effects on females' gender, and also affect osteoporosis and menstrual cycle reproductive function as a result of abnormal eating, right? In addition, the REDS claim to explain that the deficiency in energy will affect the overall performance in sport in our aspect. So in overall, REDS claim to explain the overall systemic consequence of energy deficiency and also affect the overall performance, including physical and also the psychological performance of the sports athletes, right? And as a typical style of the IOC, always having guidelines, so they classify the athletes into three groups: red color, yellow color, and the green color. The letters may be too small. You don't need to read it, every sentence of it. I'm going to summarize it for you. The green one seems to be the low risk, which is the group of normal or relatively normal energy athlete. The yellow is the in between. The red is the obvious group of athletes who now suffer from energy deficiency, right? So the table try to to show you the guideline, the criteria, so that you don't need to have any good knowledge. You just follow and make a checklist, and then you can categorize your athlete into 3 different groups according to their energy, deprivation, and balance. Right? And in conclusion, they say that if athletes belong to the red group, which shows signs and symptoms of energy deprivation, then they should not be allowed to compete, to participate in sport. They need to be treated until they get back into the yellow or green category before they are allowed to participate in sport. If they are in the yellow group, they have to be under supervision of the physician. But for the green, they can have full sport participation because they are normal, right? For the female athlete triad, if you are interested in this field of sport, medicine traces back to 20 years ago, it was the first term before we have the RCOST. And triad means 3 things. So the diagnostic criteria are disorder eating, amenorrhea, and osteoporosis, which is a special kind because you are deprived of a normal estrogen hormone. So it's some kind of osteoporosis which is resistant to calcium and estrogen treatment. And so it's kind of a quite difficult things to manage. And we have a new term for disorder eating, athletica, so athletic anorexia. The sport at risk normally is the types of sport which require low body weight, lean physique to get advantage in that kind of sport, such as cycling, distance running, triathlon. And another kind of sport which judging may be influenced by the beauty, the aesthetics of the athletes, like gymnasts, ballet, figure skating, diving, synchronized swimming, cheerleading. So slim is beautiful concept. You match this type of athletes who are trying to make themselves thin, slim. Or the other type of sport which require mainly weight for classification, for fighting, such as judo, karate, boxing, rolling, taekwondo. But boxing is not mentioned here because female boxing is not very popular. Right. Disorder eating. Overall disorder eating can be found in vast majority of female athletes because they don't only want to be smart with good performance, they want to be beautiful as well. So they want to achieve a specific body image that they believe to improve their sport performance. The consequence of being too slim, too thin, with energy deprivation is that they will be easily fatigued, intolerant to cold, maybe easily to get dizzy, constipated, bloating, dry skin, bradycardia, and menstrual disturbance. Look into the details of the eating disorders. It can be anorexia nervosa. The main criteria of the condition is that the athlete refuses to keep their body weight up or near to normal or to be normal. They always recognize themselves fatter than they usually are. They have intense fear of being fat. And they try all aspects to get slim. For bulimia, it's a bit strange because they have binge eating followed by abnormal behaviors to get rid of the food that they already get into their body in terms of having laxative, diuretics, or induced vomiting. Right? Anyway, both conditions try to cut off the energy getting into their body. The other eating disorder can be picked up as the eating disorder in order to diagnose FAT as well, right? Warning symptoms and medical complication. I think I'm going to skip this slide because we already know. And to recap again, disorder eating, amenorrhea, and premature osteoporosis, they are female athlete triad. And the major cause is the energy drain, resulting in decreased estrogen production and abnormal ovarian function, causing osteoporosis. Right? Anyway, exercise associated amenorrhea is multifactorial. Sometimes emotional stress can cause disturbed mens as well. Right? For the treatment, if you encounter female athletes who already has irregular mens, amenorrhea, then maybe we need sports gynecologists because it's the detail of using hormonal supplements in addition to trying to get them enough calorie, right? So as I talked in the beginning that the IOC consensus state, the statement which seems to be insulting on the FAT group, then Mary Jane de Souza has published a paper claiming that the IOC misunderstood the female elite triad, right? And I'm going to summarize in 4 final slides that at the moment for us who, some of you may be a bit confused what is what, I would clarify that the IOC working group state that FAT is an incomplete part of REDS. And REDS giving detrimental effects to all physiologic systems in both genders, right? And the sports medicine and sports science community should work together to increase the understanding and awareness of this condition in order to prevent and treat this condition. But for the female elite triad coalition group, they refuse the IOC consensus and say that the REDS statements still lack of adequate scientific evidence in some extrapolating consequence in other systemic effect rather than the FAT concept that they originally proposed. And the IOC did not emphasize enough on the FAT model and over-extrapolate the FAT evidence, which has been proved more than 30 years, to the male and disabled athletes and all systems apart from the reproductive system without adequate scientific evidence. Right. So my perspectives and summary. So in 1997, the Souza task force of the ACSM introduced syndrome of thyroid disorder as FAT. And then in 2007, 10 years later, they changed the eating disorder into energy availability, which is the balance between energy intake and expenditure from sport. And energy availability is the cornerstone of the metabolic and health consequence, high risk in weight, sensitive in weight category sport. And the female elite triad may be the most commonly referenced aspect of energy availability and performance. And they set up this theory, concept, and knowledge on the 30-year research evidence. And energy deficiency is not unique to women. Further research is required to expanding the consequence to male gender. For the REDS IOC group, Dr. Mountjoy and working group said that this syndrome affects all athletes, not just female. And the low energy availability means that diet intake is less than energy expenditure during sport activity. The low EA impair all body functions, including metabolic growth, rate, menstrual function, bone health, immunity, protein, cardiovascular, all systems, and impair all aspects of sport performance. Theory and guideline, anyway, is with limited research, and ongoing research is coming on with more and more evidence. So my perspective, my personal view is that actually both groups of intelligent sport people, the ACSM group and the IOC, they actually talking about the same things, the same fact about energy balance and deficiency in athletes, but from this different aspect and direction. The FAT group, they focus on the female elite triad, where there has been very solid evidence for 30 years, clinically and in the labs. And they say that it is at this stage that this concept of female elite triad is expanding to cover male gender and may have effect on other systems of the body apart from bone health and reproductive system in female. On the other hand, the REDS group, they're just talking from outside to inside. that the REDS is the big and the important concept, and fat is just a small fraction of the effect of the REDS in female athletes. So I think they should stop fighting and come to the fact that we are talking about the same thing, and just respect each other, and we come to the peace and development in the field of sport medicine. What I talk to you is a combination of 4 things. It is my personal idea. Sometimes I mention about scientific evidence. Some of the message are my personal preference and in my practice. I am a human being, so I do not refuse that I am under influence of economics, politics, guidelines, social, but it's up to you to take our message and critically consider the information I provide you today, which one is my idea, which one is my evidence, which one is my preference and practice, and it's up to you to decide which one you take back. Thank you very much for your attention.